Welcome to Sigma's Creating Healthy Work Environments. Our session is titled The Pandemic, Impetus for a Healthier Work Environment. The authors of this session are Anne Marie Brooks and Sharon Weinstein, both of the Global Education Development Institute. Our objectives are to identify the impact of the pandemic on health and well-being, to discuss disruption in the learning process and practice setting, to describe survey and outcomes. And as authors, we have no conflicts. Our work environment demands safety and well-being, and the pandemic has certainly challenged us to an entirely new level. On the forefront, our work environment is decidedly different. There is no doubt that the pandemic has placed a strain on healthcare professionals, along with longer hours, greater workloads, and higher acuity levels, plus the threat of illness. We are beyond stress. A healthy environment helps combat stress. Work isn't the only source of stress. Our home lives can be just as hectic as our work lives. We'll address all of these, but remember, we need to reduce and manage stress in all aspects of our lives. And today is different, isn't it? While the coronavirus has surged and a new variant is deemed even more challenging, acuity levels continue to rise, workloads are intense, and we are living the virtual life. You recall the movie A Beautiful Life. Well, there is no doubt that this is our version, a virtual life, one in which we experienced canceled meetings, upsets to our personal health, and uncertainty, unrest, and the unknown. The coronavirus has challenged us. The pandemic, March 2020 to present, let's look at it. Since March of 2020, we've experienced disruption in every aspect of our lives. The initial reaction was intense on the healthcare side and perhaps not taken as seriously among some. We've seen crisis, fear, struggle, and anxiety. We've seen shock, confusion, and disbelief, and yet day after day, we managed the unexpected on all fronts. Nurses were tested in every way imaginable during 2020, and nursing has again been named by Gallup for the 19th year as the most trusted profession. The impact of stress. We've experienced the ultimate risk to our lives, our safety, and that of our loved ones. For some, a lack of PPE and an overworked supply chain presented a challenge. For others, there were lots of supplies that was not an issue at all. Perhaps they were in more urban areas and had access. They were fortunate. But for each of us, we have experienced pain, stress, and disruption with high acuity levels, reduced resources, and virtual learning. And we all have responsibilities. We still do. We juggle them, some of us much better than others. We all have both personal and workplace roles. Whether it's caring for children or elderly parents or pursuing personal interests, activities, or hobbies. Some of us might be in the sandwich generation, meaning that we're juggling the challenge of school-age children or adult children who returned home and aging parents or other family members. Staff must be equipped to resolve personal and workplace issues, juggle conflicting responsibilities, and balance personal and workplace roles. I ask you to think about the power of 3. Will it matter in 3 minutes, 3 days, 3 weeks, or more? Think about the things in your life that must be done, should be done, and perhaps can wait a minute. Use the power of 3 rule to assess. I think about my grandson, Alex, who created a list of what he wanted and what he needed. Can you differentiate your own list using the 3-minute rule and estimate, will it matter in 3 minutes, 3 days, 3 weeks, or perhaps more? If it's not going to matter immediately, perhaps it can be put off. Self-care is not selfish. There's a reason the flight attendant instructs you to put your own mask on first, isn't there? Our physical and emotional health has suffered as a result of anxiety, fears, frustration, sleep challenges, and fatigue at levels that we have never before seen. We must take time to care for ourselves. You've heard it in the past. If you don't take care of yourself, how can you possibly be prepared to take care of others? We need to take care of ourselves, and that means hydration, adequate sleep, power naps, calming music, deep breathing, exercise. Mark it on your calendar. Take 15 minutes per day and just do something for yourself. In the same way in which you recharge your phone when the battery dies out, you must take time to recharge your mind, your body, and your spirit. Nursing satisfaction during the pandemic. We took the opportunity to survey students, clinicians, nursing leaders, and faculty to determine the impact of stress, high acuity levels, reduced resources, and virtual learning on the work environment. We determined that now, more than ever before, health and well-being are at risk due to unhealthier work settings. Fear and frustration levels rose and challenged our ability to remain safe, enhance competencies, and ensure a healthier workforce for our future. The questions we asked were: what is your current position? How long have you been in your position? Which of the following is the greatest work risk for you during the pandemic? Rate the visibility and accessibility of leaders. Rate your level of support and connection to peers and team. How often do you practice self-care on a regular basis? Please rate the accessibility of mental health resources provided by your organization during the pandemic. How do you personally feel about the safety of your workplace and work for the next 6 months? And have you perhaps considered a change in employment? We received astounding results. First of all, there were 574 surveys that were sent out to attendees at a global conference, with 378 responses, or a near 66% response rate. As you know, there were a wide variety of positions: founder, recruiter, sales, chief nursing officer, director of nursing, magnet coordinator, director, or even laid off. The average time in position averaged 1 to 5 years. The greatest risk was safety and workload. Visibility and accessibility were ranked 41.7% effective. Support and connection were 61% good. Self-care, 58% of you, or of those respondents, practice self-care on a daily basis. Mental health resources were ranked at 44% satisfactory. Safety, 36.1% were satisfied, and 58.3% committed to remain in place. That's something we should think about as we face our ongoing nursing shortages. New has become next and now. If I asked to list 3 things to improve the health of your work setting, what would come to mind would be consistent availability of PPE, employee assistance programs, and a vaccine program. Pause for a moment and consider what you would have answered if asked these questions. While there are no right or wrong answers, it's important to understand that we have been experiencing what we've been experiencing as part of these challenging times. And what about you? This is the face of COVID. Your participation in this conference indicates your interest in learning more about creating, implementing, and sustaining a healthy work environment. We must have it. So I ask you to take your Temp. The tool that I'll discuss in the next few minutes provides the user with a simple assessment and reality check. In the past few decades, a great deal of attention has focused on situational awareness with the phrase, see something, say something, do something. Perhaps you've seen it in a subway, in a metro, in a conference hall, in a train station, at the airport, or in your building. Take your Temp. Look at the words Temp and think thoughts, energy, mood, perspective. What are your thoughts as you enter a room or a patient encounter or a meeting with someone else? What is your energy level? What is your mood, and can you switch it? And what's your perspective? Be sure to take your Temp before any encounter with anyone in your space. It's really important. Situational awareness matters. A global approach. The pandemic saw no borders. We were all eligible for the disruption that it caused. During this time of extreme need, nurses risk their own lives and that of their loved ones to provide care for our patient populations, sometimes in less than ideal circumstances. Some of our colleagues abroad were in the midst of a war during the time that they were also facing the disruption of the pandemic. The pandemic has caused grave concerns and knows no boundaries. It is not a matter of if, but when we will regain control of the current situation, be ready within the healthcare sector, and ensure positive outcomes. A healthy work environment begins with the learning process and extends to the practice setting. And so, what is the impetus for a healthy work environment? The concept of a healthy work environment has been challenged with unimaginable stress levels, personal risks, and of course, burnout. Long term effects of the pandemic remain unknown. Nurses experienced a range of effects, including feelings of insecurity, fear, and pressure to provide care under challenging circumstances. We had no idea what we were facing, but we rose to the challenge and we have provided good care. In spite of a very high census in hospitals, higher acuity levels, and fear for our own lives and those of our patients. The important thing is that together we'll succeed. The world of work will never be the same, will it? The coronavirus has fundamentally challenged every aspect of our healthcare environment, from the commute to our clinical or academic setting to virtual care and classes. We feel the disruption and we sense the results. Many of our peers faced their own mortality, realized how vulnerable they were, and grieved for family and friends who succumbed to the disease or whose care was compromised because of it. Social distancing has removed our ability to reach out and touch someone, to hold a hand, to wipe a brow, and to enjoy fellowship. Every crisis has new heroes, and today's most visible heroes are the healthcare professionals working on the front line and on the finish line, risking their own lives while doing so. Together we'll succeed. We continue to face social and physical distancing, and it has become our new norm. But we will overcome this. We will see a brighter future and a brighter tomorrow. Certainly, the vaccine holds promise and will impact our results. For now, remember that together we'll succeed. I want to thank you for joining us today. This is important information, and this conference is critical to our success. Please be safe, be well, mask up, and take care of those committed to your care. Thank you.